Nigeria to verify and validate 3 local claims for coronavirus cure.
Federal government will not compromise the health of any Nigerian. Whatever is approved for use in Nigeria must meet the required standard.
Chairman Senate Committee on NDDC reacts to allegations of 2019 budget padding.
As legislators, we have a right to appropriate. It is a constitutional right. No amount of intimidation or blackmail will stop us from exercising it.
Trial of former head of the Civil Service of the Federation, Winifred Oyo-Ita, adjourned to 8th July.
And on Good Morning Nigeria today, we shall again return to situation reports in the states in terms of COVID-19. Now, for the past 7 weeks, Good Morning Nigeria has been accessing the state's response to the coronavirus pandemic. Last week, as usual, we had a cross-section of guests from different states, including Cross River, Ekiti, Enugu, and the Federal Capital Territory.
The Executive Governor of Cross River State, Ben Ayede, joined us via Skype, where he maintained that the coronavirus-free status of the state is due to the technical and strategic action plan put in place before the spread of the virus.
And the governor also highlighted the closure of borders, wearing of face masks, as well as a 400-man surveillance team across the state as effective tools in combating COVID-19 in the state.
From our Enugu Network studio was the Commissioner for Information, Nnayelugo Chidi Aro, who drew attention to the 3 functional isolation centers in the state and was emphatic on the progress made by the state government in its response to COVID-19 as against contradictory reports circulating in some sections of the media. He also disclosed the incentives for medical practitioners in the state, especially those on the front line of the fight against COVID-19.
Now, Margaret Fagboyo also joined us via Skype. Now, she is the Special Advisor on Development Partnership and Sustainable Goals to the Ekiti State Governor. Now, she is also the Secretary of the Ekiti State COVID-19 Committee. She made reference to the 49-person task force constituted by Governor Fayemi, and the task force, of course, working very closely with the National Union of Road Transport Workers to maintain the guidelines on social distancing as well as sensitization in rural communities, among other response mechanisms.
However, Dr. Mohammed Kau, Acting Secretary, FCT Health and Humanitarian Services Secretariat, who was also a guest, raised concerns about some challenges still being faced in the Federal Capital Territory. He noted, regrettably, that in spite of the level of information dissemination on COVID-19, patients still die due to ignorance and carelessness.
Now, the issues are quite peculiar to the different states, as it were, but many maintain that efforts towards curbing COVID-19 can be more effective, especially in the face of a rising number of infections.
Indeed, Kingsley, because as at May 27, the number of coronavirus cases from NCDC is put at 8,733, with 254 deaths, while recoveries are now 2,501 so far.
Well, of course, Nigeria ranks amongst countries on the African continent that are most impacted by the coronavirus. Other countries, of course, include South Africa and Egypt. And quite frankly, the point, as experts say, is that community transmission is still on. And that point was, of course, also emphasized during the Presidential Task Force briefing on Wednesday. The chairman, who is also secretary to the government of the Federation, Mr. Boss Mustafa, harped on the need to slow down the rate of community transmission of coronavirus in Nigeria.
And for Nigeria, the reality of mitigating community transmission may not be a low-hanging fruit at the moment, especially as states are gradually easing the lockdown and lifting ban on religious activities. In fact, the Minister of Health, during one of the briefings, also said, though there are currently about 120 isolation and treatment centers with 5,344 beds nationwide, the need to scale up capacity is expedient.
All right, now states are once again on the front burner today, and issues on the response to COVID-19 remain pertinent. Now, from information dissemination to testing, surveillance, and all of that, as well as preparedness in the case of isolation and treatment. What exactly are the challenges of implementing the measures to contain the virus? These and more will form the nucleus of our conversation on today's edition of Good Morning Nigeria. My name is Kingsley Osadolo. It's a pretty wet morning here in the Federal Capital Territory.
And I am Kirian Umari. Many thanks for joining us on the program this morning. We are reaching you live on the network service of the NTA. Newspaper review segment, business and others will also complement the program. But first, let's join Comforter Modu for the morning news highlights. Hello, Comfort.
Good morning, Kieran and Kinsley. Let's start with the latest figures from NCDC. At about midnight of 27th May 2020, the Nigerian Center for Disease Control confirmed 389 new cases of COVID-19 in the country. A breakdown of the figures show that Lagos has 256 new cases, Katsina 23, Edo 22, Rivers 14, Kano 13 and 11 for each of Adamawa and Akwa Ibom states. Others are Kaduna 7, Kwara and Nasarawa has 6 each, 2 each for Gombe, Plateau, Abia, Delta, Benue, Niger, Kogi and Oyo states, while Imo, Borno, Ogun and Anambra states recorded 1 case each. And following this development, Nigeria has a total of 8,733 cases of COVID-19, out of which 2,501 were discharged. Unfortunately, 254 patients have now died of the virus. 3 local claims for coronavirus cure have been singled out for verification and validation by the Federal Ministry of Health and its agencies. Secretary to the Government of the Federation and Chairman of the Presidential Task Force on COVID-19, Boss Mustafa, at the first daily briefing post-Salah holiday, hinted that the Central Bank of Nigeria has also indicated interest in supporting research for local remedies for the novel coronavirus.
The Federal Minister of Health held a virtual meeting with a number of researchers and scientists with claims to cure of COVID-19. And out of the numerous claimants, 3 were found to deserve further investigation and have been forwarded to the relevant authorities for appropriate review.
While we are anxious to find a cure for the disease, this COVID-19, the federal government will not compromise the health of any Nigerian. Whatever is approved for use in Nigeria must meet the required standard.
Meanwhile, Information and Culture Minister Lai Mohammed says plans are underway to amend the Act establishing Nigeria's National Endowment for Arts in a bid to meet the demands on the creative industry as a result of COVID-19. The minister stated this while addressing African ministers responsible for arts, culture and heritage.
For us here in Nigeria, the impact has been particularly devastating because of the importance and relevance of the sector to the national economy. The Nigerian creative industry is large, diverse, dynamic, and critical for economic growth, development, and diversification.
Of the Federation, Dr. Fola Shadeyemi Esan has inspected some of hygiene and safety facilities within the Federal Secretariat to ascertain their sustainability to safeguard the safety and health of civil servants in their workplaces. The head of service says the measures are in compliance with best health practices to promote safe working environment and guarantee welfare of the workforce. Some of the facilities are hand-washing containers, hand sanitizers and physical distancing and other safety guidelines against the coronavirus pandemic.
Out guidelines to permanent secretaries on what they should do and what they should provide for staff. So I'm here to find out if the permanent secretaries here have complied with all those instructions.
Coordinating the maintenance, provision of facilities could be very challenging, but we're on top of it.
And in response to the global health challenge posed by the coronavirus pandemic, the Nigerian Air Force has recorded a breakthrough in the production of emergency ventilators expected to contribute to containing the effects of the virus. The development is in partnership with some Nigerian universities.
Today is thus a further demonstration of my resolve to ensure that Nigerian Air Force continues to make significant contribution to the development of the country.
Homegrown technology is better because you have these parts readily available, you have the knowledge to maintain it if there's any problem.
Absence of the prosecution counsel Wednesday has stalled the trial of former head of the Civil Service of the Federation, Wilfred Oyo-Ita. Oyo-Ita and 8 others were arraigned on 8-count charge of 3 billion naira fraud in relation to duty tour allowance, estate codes, conference fees, and receiving kickbacks on contracts before Justice Taiwo of the Federal High Court, Abuja. They had, however, pleaded not guilty. Mrs. Oyo-Ita was arrested last August and released on administrative bail following the absence of EFCC prosecution counsel. Justice Taiwo, who directed that hearing notices be issued, adjourned the case to 8th of July for hearing. Now, Chairman Senate Committee on Niger Delta Development Commission, Senator Peter Nwabushi, says there was no illegality in the consideration of the 2019 budget of the Niger Delta Development Commission, NDDC, on the allegation that the National Assembly illegally added 500 projects to 2019 budget of the NDDC. Senator Nwabushi made these clarifications.
Of Nigeria, it has 1,000 jobs. House of Rep has this. Why do you waste and dissipate energy? Why do you heat up the system? Please let them publish these facts and take these facts. If they are convinced with the facts before them, let them take it to the appropriate security agencies to take the necessary action.
He also spoke on the allegation that a senator receives 1 billion naira monthly, 1,000 jobs and 350 contracts from the commission. Senator Nwabushi, however, said the Senate will not be distracted from its ongoing investigation on the Interim Management Committee. And that concludes the news highlight for now. Good Morning Nigeria will continue on COVID-19, of course, on Situation Reporting State, with Kingsley and Kirian immediately after this break. Good morning.
Main way coronavirus spread is when infected people sneeze and cough. Small droplets of fluid expelled by cough or sneezes are laced with viruses looking for new respiratory tracts to infect. When a sick person sneezes around someone who is healthy, the virus can land in the nose, mouth, or even the eyes, causing an infection. Symptoms can include fever, cough, shortness of breath. Symptoms may appear within 2 to 14 days. Seek medical advice if you develop symptoms and have been in close contact with a person known to have COVID-19, or if you live or have recently been in an area with ongoing spread of COVID-19. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network. In this time of despair, our country, Nigeria, needs us now more than ever. We stand a chance to save our great country, Nigeria. A chance to rise up from this pandemic stronger and better. What will be the gain? if we do not learn from other countries and observe the lockdown to stop the further spread of the virus. If we loosen our guards and allow this virus doom our very existence, then what have we gained? This is the call to every Nigerian to unite as one and stop the spread of this deadly virus. Stay at home and stay safe. Remember, the virus doesn't move unless we move. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network. We have observed the lockdown. We have practiced the measures in order to curb the spread of the virus, but we can do better. The coronavirus spread is increasing daily, and only together can we cut down the numbers and defeat the spread of the virus. Remember, COVID-19 is not a death sentence, and a recovered patient cannot spread the disease. Do not stigmatize. Do not hesitate to report any case, or if you have come in contact with anybody that has been infected with COVID-19. If you have cough and fever, please stay at home and call your state hotline. Find state numbers at www.covid19.ncdc.gov.ng. Remember, it is for your own good and for the good of every Nigerian. Let us do better and defeat the virus. Together, we can do this. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Do you not know that our enemies have no face? They are indigents of no state. They come from no place. And if this boat capsizes, every one of us will go under. So when the drums sound, let everybody answer. Do not say, I am the Iroko when the forest is burning. Do not say, I am the Obeche when the forest is burning. Our differences will not stop us from perishing together. So when the drums sound, let everybody answer.
You are watching Good Morning Nigeria on NTA. Now, let's go business. CBN reduces interest rates on its facilities from 9 to 5% as Nigerian Stock Exchange opens the week positive, with trades firming up by 0.07% after the public holiday to mark Eid al-Fitr. Let's now join our business desk for details.
To prepare and then get our factories back, create jobs. Let us begin to see the fumes coming out of the rooftops of the manufacturing companies so that we can be adequately prepared for the battles ahead.
The Central Bank of Nigeria has renewed its commitment to ease the impact of the coronavirus pandemic on households, businesses, and regulated institutions by reducing interest rates on its facilities through participating other financial institutions from 9% to 5% per annum for a year, effective from 1st of March 2020. Director of Financial Policy and Regulation Department Kelvin Amugo in a statement says CBN has equally granted other financial institutions leave to consider temporary and time-limited restructuring of the tenor and loan terms for households and businesses affected by COVID-19. Also, the World Bank, in its effort to strengthen resilience and livelihoods in the Lake Chad region, has provided $346 million financial support to Cameroon, Chad, Niger, and Nigeria. The bank says the projects are to be financed through the International Development Association. This is to enable the Lake Chad Region Recovery and Development Project, which it allotted $170 million, support national and regional coordination platforms and local capacity building, while the multi-sector crisis recovery project for northeastern Nigeria, additional financing assigned $176 million is to improve access to basic services for crisis-affected communities in the northeastern states of Adamawa, Borno, and Yobe. Also, the bank says it will expand the ongoing $2 million multi-sector crisis recovery project and ensure enhanced emphasis on support for agricultural livelihoods and investments. And activities on the floor of the Nigerian Stock Exchange closed on a positive note, with investors gaining 8.59 billion naira after the public holiday.
So that's our business package for this morning. Next is newspaper review.
And let's welcome our newspaper reviewer, Bayo Atoyebe, this morning. Bayo, it's a pleasure to have you again.
Thank you. Good morning. Good morning, Kinsley. Good morning, Nigeria.
Bayo, good to see you. Okay, let's begin with the Nation newspaper, fairly busy on its front page. Above the name flag, to the left side, it says, additional. I'm still AFDB's president, that's African Development Bank president, with rider allegations untrue. Details on page 6. Wrongly jailed Nigerian gets $10 million compensation. That's another story on page 6. Kano abolishes Amajiri system to enroll street kids. That's page 4. And the two photographs there on the front page, it says with a caption, Isaiah Yamu vows to beat unstoppable Obaseki for APC ticket. It says on the left side is the chairman of Obaseki Mandate Forum in Abuja, displaying the APC governorship primary nomination and expression of interest forms collected on behalf of the incumbent governor. And on the right is Pastor Osagi Ezeyamu, also receiving his nomination and expression of interest forms at the APC headquarters. Lead story says, process to reopen schools and worship centers begins. And you have a number of riders there. It says, safety key to reopening. PTF, that's Presidential Task Force, and religious leaders meet in Abuja. No date yet for classes to start. Now, conditions to reopen schools. Phased resumption of junior and senior schools. Introduction of morning and afternoon classes. Semester within semester in universities and others. And for conditions to reopen worship centers, decontamination of churches and mosques, use of sanitizers and temperature readers, and use of CCTV to decongest churches. General conditions. Preventive measures must be in place and adoption of WHO protocols. Virus positive Nigerians won't be brought home, and monitored isolation for returnees ends. And then, of course, inside you have other details by way of riders. Those details are on page 8. And they include 5 states and FCT meet 300-bed requirement. Rivers warns hotel owner. Cross Rivers testing capacity low. 300 test negative in Taraba. Sale of cow drops in Southeast. Akeredolu opens worship centers. Osun unveils burial protocols. And PTF okays 3 cure solutions for tests. The sidebar is also there indicating the figures from around the world and also in Nigeria. Federal government inaugurates storage facility in Benue, that's page 4, right at the foot of the front page. And Kano NLC threatens strike. Gideon.
All right, now to the Daily Sun newspaper. From the top, actually on the right-hand side of the nameplate, Marjorie Dangote opens up on influx to southeast. It's on page 27, reaches out to Ohanese. The lead story on the Daily Sun this morning, federal government moves to reopen schools with a rider to release safety guidelines, adopts two-shift system. The story is on page 7. Now on the photo story on the Daily Sun newspaper, primary school pupils protesting the killing of children during Children's Day in Jos, Plateau State yesterday. That's the photo story there. Below that you have COVID-19. 3 local drugs pass first test. It's on page 7. Senate, Akpabio at war over NDDC probe. With the 2 riders, no amount of blackmail will stop investigation, according to senators. Now, audit report will expose blunderers of the commission, according to minister. It's on page 6. We can't fight COVID-19 on empty stomach. That's according to Dan Juma. It's on page 27. Right at the bottom, AFDB, that's African Development Bank, I have not resigned, says additional. That's on page 2 of the Daily Sun. Let's bring in Bayo now.
Well, let's start with the issue of the African Development Bank. The additional had been given a clean bill of health, but the United States raised objection and has raised fresh issues. And the president of the bank says he is ready to put his integrity to test, and he's ready to be further investigated. But United States is one of the shareholders, but Nigeria is among the largest shareholders on the continent of Africa. Meanwhile, coming to COVID-19, Nigeria registered its highest cases ever, 389 in one day. And this time around, 2 of the cases, Kogi State registered its first case, registering 2 cases. It may be recalled that Kogi and Cross River had held on without any cases. When 5 deaths were reported at the Federal Medical Center, Lokoja, the NCDC sent its personnel to go and investigate. Kogi welcomed them, but insisted that they must abide by their own rules, meaning that coming from an endemic area, they had to be quarantined for 14 days. Not prepared to be ensconced for 14 days, they returned to Abuja. Meanwhile, on the 18th of May, NCDC reported that Kogi had only tested 1 sample at that time. Cross River also tested 7, and the 2 states reported negative. At that point in time, Lagos had already tested 14,886, Federal Capital Territory 4,688, and Kano 2,653. That the argument is the more tests you conduct, the more likelihood that you are going to find cases. But then Kogi now came with a random sampling of 111 people, and Dr. Saka Haruna, the Commissioner of Health, reported that they were all also negative. Since that time, Kogi State said they have bought 5,000 antigen test-based kits and has established 3 test centers. Perhaps this is why we are beginning to see the results where they had 2 cases now. They say that the test kits they have in Kogi is an upgrade of what the Nigeria Center for Disease Control has, and it can produce test results in 30 minutes. So let's continue to look out to Kogi, and they will probably, the more tests they do, will be able to. But the doubts that has been created on Kogi is not unique, in the sense that even the World Health Organization is casting the doubt over Africa. As at yesterday, the World Health Organization was saying, why will Africa report only 3,400 deaths when the whole world has recorded 344,000? So the World Health Organization said Africa is not testing enough, or rather not looking deep enough. The same argument is being applied to Kogi and Cross River. They are probably not testing enough. Now, the former president, Olusegun Obasanjo, has also talked about COVID-19. He says COVID-19 has taught us 3 lessons. First of all is the food security, which we must be taken seriously and implemented through policy implementation. The second is information and communication technology, which must be used to revitalize the economic needs of the nation. The third is to lever on the African Free Trade Agreement for bilateral and multilateral trade so that we can use it to enhance trade within the African continent. The president says that in spite of the fact that COVID-19 is disruptive, it has also become an eye-opener in areas of priorities for the world to focus on. Still on the issue of COVID-19, the Christian Association of Nigeria is hoping that by the end of June, the ban on religious worships will be lifted. President of CAN, Reverend Samson Ayokole, says that they are consulting, and the argument is that if government did not find opening markets and banks to be safe, why will they hesitate to open churches? The argument is that churches are better organized than markets and banks. And so they say that after 8 weeks of suspending church services, CAN is now in discussion, along with the Nigeria Supreme Council of Islamic Affairs, with the PTF, as well as Nigeria Center for Disease Control, to see how they can open up. And meanwhile, the issue of Almajiri that reported about Kano, about schools, the same thing is happening in Gombe. 153 Almajiri who actually were repatriated from Adamawa and Gombe, Adamawa and Bauchi to Gombe, have now graduated. The 153 were specifically inaugurated yesterday during the Children's Day. Governor Muhammad Yahya said that the state is determined to provide them avenues for Western education along with Islamic education. Meanwhile, they are to be reunited with their families in their local government. Their home local government are Duku, Nafada, Balanga, and Yamultu local government area. They've since been provided with beautiful kits and other school material. They are to be registered in the Baseda Educational Institution.
Yeah, this is one of the good side of coronavirus, Kingsley. You know, I mean, we've been discussing about Almajiri in this country for over decades now. You know how this group of young children can be managed in the northern part of the country. Well, things are playing out now. That states are owning up. When you repatriate their citizens or their indigents, they will accept and, of course, try to rehabilitate them. That's a good development. And now, from what you said, that Kano has indeed, banned Almajiri system, right? From what
that's right. That's
read now. So it's a healthy development, you know, in terms of development and ensuring that we don't have the Almajiris who will now grow up to maybe 18, 20 years. Forming part of those now that we say would have been, that are crisscrossing the whole southern part of the country, in batches, right? So it's a healthy development.
In fact, Kaduna State is emphatic about it. As far as Kaduna State government, the governor declared that the Almajiri system is dead, and they have already put a law in place. Anybody who tries to recruit people for an Almajiri system will face the wrath of the law. And it was a decision, a collective decision of the governors of northern states, after several meetings with traditional rulers. It was in fact to take place in September, but it was fast forwarded because of COVID-19.
Exactly.
Yeah, that's as been indicated. I mean, it's the right way to go. It's an issue that has often engaged us here on Good Morning Nigeria as topics for conversation, and the fact that this is a human resource base that ordinarily should be cultivated. The system has been bastardized, as the experts would say. But right now, if there are modern ways of reforming it, and the state governments are taking up this responsibility, they should go ahead and get it done. I think that, for me, one of the critical issues here in the papers this morning has to do with the late story of the Nation newspaper, which says process to reopen schools and worship centers begin. The conditions for reopening schools and the conditions for reopening worship centers are more concerned now about the conditions for reopening schools. Now, listening to the presidential task force yesterday, I don't think that these conditions have been formalized yet. I think they seem to have been hints as to the kind of conditions that may be stipulated for the reopening of schools. Now, one point to note almost immediately is that there cannot be one size fits all. I think that should be clear. There cannot be one size fits all, and particularly for tertiary institutions. Those tertiary institutions should be requested to submit their own proposals for reopening, bearing in mind that they would have accommodated the protocols that are required under the coronavirus pandemic. Now, to suggest, for instance, that you have introduction of morning and afternoon classes for school, how is that going to work in Lagos? 40 years ago, it took the effort of the then governor of Lagos, Lateef Jakonde, to defeat that chronic system of morning and afternoon session, because it was counterproductive. To have children go to school in the morning and then you had shifts. At some point, they were even having evening shifts. When Jakonde started 40 years ago, they said he was building cow sheds, but he used that to defeat the morning and afternoon session. Now, if you say morning and afternoon session, are you going to have the manpower that will start from 8 in the morning till when the classes will end?
Yeah, the complexity of the situation is quite dire, at this point in time. Because what about boarding schools? There are schools that have high schools that have boarding system, right? And of course, tertiary institutions. So how are you going to cope with that? People are going to live in hostels, right? As always. So the issue is that, just as Kingsley pointed out, that look, they have to find a way to formalize a protocol that will address whatever is going to be the new normal now in tertiary institutions and in fact in all schools. What about primary schools? We have children, some classes up to 30, 40, pupils in a class and all of so, and even the infrastructure aspect of it is also a problem here. How do you now go back to shift? As Kingsley say, it is counterproductive going back to shift morning and afternoon. It is not just workable.
I think this is part of the thinking process. They will need the school authorities to come together. But I think the priority now should be given to those who are the critical stage. Those who are in primary 5 or primary 6 who will be sitting common entrance should be at least first go to school. Those in JSS 3 who will be sitting exams to go to, and those who are in SS 3 who will be sitting exams to graduate. Those should be the first priority so that you'll be able to manage those ones. That will be used as the experiment. Then you'll be able to see how you accommodate the junior ones when they come. Because those ones must for the exams which cannot continue to wait indefinitely. Right. So that we don't continue to have a backlog. But the challenge of the schools is quite formidable in the sense that most of public schools are overpopulated. And it will be difficult to accommodate this social distancing and the health conditionalities if the schools are to open, particularly the challenge of manpower.
Kirian, you would know that, for instance, that the point that Bayo has just raised now, the conditions in top-flight private schools are not the same as you find in public schools. Yes. So will it not be to say that, okay, those who are attending private schools continue to stay at home because the protocols or the infrastructure in public schools have not been worked out? So it's a matter of saying, listen, establish a basic model. This is what you must have. What are the things that you need to have? I mean, some experts have been indicating that this virus is going to be around for a while. And so you have your face mask, you have your sanitizer, and then your hand washing regularly. And incidentally, you have low-tech facilities now for hand washings. The one you use your foot pedal to dispense the soap and dispense the water. So everybody's not going there regularly to turn that. So these are things that schools can acquire.
And those things have to be provided, of course. And I mean, do they have the wherewithal in terms of funds to do that?
No,
that's one story.
Kwara Polytechnic, Auchi Polytechnic have got a beautiful one. We use a leg pedal for hand washing, and which can be at least provided for the schools. But you see, the challenge is more in public schools than in private schools. Because in the private schools, the congestion is not as heavy as in the public schools.
There's a story here that Kingsley read. The wrongly jailed Nigerian gets $10 million. I think that should be in the U.S.
Yes, it's in the U.S.
But why is U.S.? Because there's always this miscarriage of justice. Remember Archie Williams of Louisiana, who spent 37 years in jail for an offense he didn't commit. He was released just last year.
I usually carry out the details on this story. I read the story. The details here are a bit scanty. But it said he had spent 15 out of the 18 years for which he was jailed, and it was a case of mistaken identity. This is part of the challenge you find with the criminal justice system globally, in some states in the U.S. Oftentimes it is minorities, such as African Americans or blacks in general, that are usually at the receiving end of this miscarriage of justice.
Yes, Archie Williams is a black.
Or a policeman with his knee on the neck of an African American, and it was so severe that the guy died there.
That's right. Those police officers have been dismissed.
Yes,
there are down campaigns for them to be charged with murder.
Now, editorial is from Leadership newspaper, Our Stand. Police harassment of journalists. Bayo.
Well, this is talking about the unfortunate challenges we had during the COVID-19. You will recall that even the president, when he was declaring the lockdown, indicated that journalists are among the essential workers, like health workers, those in the telecom, and the banks who were supposed to provide some limited services were exempted. But unfortunately, because the security forces were faced with the challenges of people beating the interstate lockdown, the Inspector General of Police gave instruction that nobody should be allowed to move. And they carried it overboard to the extent that in Lagos, you had health workers with patients in ambulance were stopped from moving. Journalists who were working late met during curfew and they were stopped from moving. And so the editorial is happening on the fact that it is not enough for the Inspector General of Police to give instructions, but the police themselves must use their discretion, especially when the Commander-in-Chief has indicated those who should be exempted. And the editorial is blaming the poor education of some of the security agents for their inability to use their discretion as required properly. But be that as it may, I think as a last instant, the Police High Command had rectified that error, and I think those challenges have been overcome now.
All right, Bayo Tebe, thank you very much for being around today. We'll see you tomorrow.
Thank you.
It's Good Morning Nigeria, live for the network service of Africa's largest television network, the Nigerian Television Authority. We're taking a short break. Now, when we return, our focus today will be to return to the states to see how they are responding to COVID-19.
The coronavirus, also known as COVID-19, is spreading at an alarming rate all over the globe, including Nigeria. With the number of infected persons in Nigeria increasing daily, prevention is better than cure. Coronavirus has no cure. The virus spreads from one person, who affects two persons, and by the time the affected person is isolated, the two persons have affected four, and it keeps spreading. You must take preventive measures to save yourself and that of the people around you. Always wash your hands with soap and water. Put distance between yourself and others. Whenever you cough or sneeze, cover your mouth. Clean and disinfect surfaces. Stay at home if you're sick and contact the proper authorities. Together, we can cut down the spread of the coronavirus. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest TV network.
Welcome, dear. Have you washed your hands?
Inside my house again. This thing not the key black man.
I don't know if it's misinformation or poor hygiene that will kill you first. Coronavirus is real, and good hygiene practice will save your life. Anyway, no hand washing, no eating.
I will not take care of it. How's one of the parents?
Coronavirus is real and it's on the rise. But you can help yourself and help others to be safe. Remember, we can stop the spread. It's in your hands.
This message is from the Akin Fade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
If you're just joining us, you are watching Good Morning Nigeria on the network service of NTA. And now we are taking a look at situation reports from different states. And as a prompt to our conversation this morning is excerpts from last week's discussion as compiled by Victor Azu.
We closed our borders quite early. We introduced the use of face masks quite early. And so we're so fast and far ahead of the virus that at all times we're totally ahead. And that explains it. And more so that I understand the etiology properly of the virus, so I understand what to do. And that's why we're still where we are. And I'm good to mention that NCDC has just left Calabar yesterday and gave us a clean bill of health and confirmed indeed that based on the structural and normative frameworks and actions we have instituted so far, it is obvious and clear that now they can justify and explain why we're still COVID-19 zero in terms of confirmed cases.
Enugu's preparedness is at its best. Now let's take the isolation centers. His Excellency the Governor directed immediately we got into this global pandemic that we establish an isolation center. On the advice of our medical professionals, we moved that isolation center from Kolari to Parkland so that it can have access to all the medical facilities that teaching hospital provides. But calculating that things could get out of hand, His Excellency immediately established another isolation center in Osoka and then converted our diagnostic center to a 200-bedded isolation center here in Enugu. Right now, the 3 isolation centers are fully functional. They are fully equipped with all it takes for the centers to work well. This includes the provision of PPEs for all our medical staff. Of course, thanks to Kakovid, who came to support our effort after we had established a 100-bedded capacity isolation center at the diagnostic center. Kakovid came in to help to upgrade the place to 200-bed capacity. But before they came, the essential things were there.
We just procured our molecular diagnostic laboratory installed at our Ekiti State University Hospital. With the installation, Ekiti State will be able to carry out its own community testing and can be more scientific in its deployment of resources in combating the pandemic.
We have gone to the other communities that we have not been to do contact tracing, searching and testing. As I said last time, we have a laboratory, 54-gene expert lab that has been donated to us. We just had a meeting yesterday with the Minister of State for Health, and PAMSEX is going to be activated anyone from now to add to the number of cases that we're going to be testing.
We have professors of virology, and I trust Nigerian professors. They are extremely, extremely good. The universities are not using them. Why are we flying in reagents into Nigeria? Why are we flying in reverse transcriptase into Nigeria? Why are we not producing it?
All right, thank you very much, Victor Azu, for the excerpts from our conversation last week. Now we have today another set of guests from our Kaduna Network Center. We're being joined by Dr. Amina Mohammed Baloni. I hope I got the inflection right. She's the Honorable Commissioner of Health for Kaduna State. Dr. Baloni, pleasure to have you with us on the program this morning.
Good morning, everyone, and thank you for having me.
Okay. And then from our Port Harcourt Network studio, we're being joined by Dr. Tokbe Olamuyiwa, a consultant and family health physician. Pleasure to have you with us, Dr. Olamuyiwa.
Everyone, thank you for having me here this morning.
And from Dutse in Jigawa State is Dr. Abba Zakari Omar, is the Commissioner for Health in that state. It's a pleasure to have you this morning.
Good morning, and pleasure having me on this program this morning.
All right, and our regular guest is here with us. He is Dr. Mohammed Kau, Acting Secretary, FCT Health and Humanitarian Services Secretariat here in Abuja. You're welcome.
Thank you.
All right. Once again, I'd like to have you all join us for this conversation. As my colleague Kiran just indicated, Dr. Kau is our regular guest that provides briefing on the Federal Capital Territory. But last week, if you recall, Dr. Kau, we didn't have the opportunity of getting into other aspects of the management of COVID-19 in the Federal Capital Territory. More particularly with the contiguous states around the Federal Capital Territory. Nasarawa, for instance, there is a great deal of fluidity in terms of the movement of persons across the boundaries between the FCT and Nasarawa. That's to say, the Bararaba, Yanya, Karo axis. And then towards Niger, you also have persons coming in from Zuba, Mandala, and Suleja, and elsewhere. Plus, of course, there's also Kogi, which is the border towards the south of the Federal Capital Territory. So give us a sense of what is happening in terms of the management of COVID-19, either in terms of case management or containment measures. In particular, are you managing cases from other locations?
Yeah, thank you so much. Last week I said something here that the Minister of Health and the Minister FCT and the two Ministers of State and the technical crew, both from FCT and Federal Minister of Health met. And the decision was that all contiguous communities around FCT, if they are diagnosed, they should be managed in FCT. Because they are all Nigerians, and there's no point moving a patient from, say, Mararaba to Okaru to Lafia, or Suleja to Mina. So we'll be managing a lot of cases that are cases from those states. And even the recently announced cases from Kogi, actually they are being managed presently at National Hospital, Abuja. They were referred on 24th or so from FMC Lokoja to National Hospital, and where the gentleman was diagnosed as having COVID-19, and his very close contact was also tested and became positive. But we have immediately contacted Kogi Epidemiology State Epid gentleman to ensure that they do their contact tracing and line listing of all the contacts of these people so that they are all tested, so that all those found negative, as usual, should be removed from the communities so that they don't infect other people. So
those found positive?
Yeah, those found positive, yes. So for us in FCT, we manage any case that is diagnosed, either being referred to or living around FCT and is diagnosed. The only thing we do is we ask the epidemiologists of that state to get us their EPID number, because the protocol is that if I get infected in a place, I'm the case of that place. So I should have EPID number of that state. Why I manage is immaterial. But for record purposes, for data and information, and for the epidemiological studies and other things, you are a patient of that place. So that's what is happening.
So from all indications now, we have 2 cases in Kogi State.
Of course. Okay. It was announced by NCDC.
All right.
Sorry, Karen, just before we leave him, Kogi is unique. For several weeks, Kogi had been recording negative numbers in terms of COVID-19. Do we have an indication of how and where these 2 cases, or let's say even the index case, might have been infected, and therefore have a hazy idea of how widespread the contacts might have been?
Yeah, I understand the case was referred from one of the local governments to FMC Lokoja. And I probably think they suspected that the gentleman may have COVID-19. Maybe they couldn't test. I don't know. They were referred to National Hospital. So the issue is that there is infection going on somewhere. And I think it's the responsibility of the state to comb the area and do a lot of testing so that whoever they find infected should be isolated and treated. Otherwise, it's not going to be good.
In fact, as it stands now, Kogi is a green horn when it comes to the issue of fighting coronavirus. And from all indications, somewhere around that state, there is infection. That is what has been established by what happened 2 days ago.
Definitely.
All right. Now, let's go to Kaduna, where we have Dr. Amina Mohammed, who is, of course, the Kaduna State Commissioner for Health. There have been a number of coronavirus patients discharged in Kaduna. Some of for them are some Almajiri students who were repatriated recently from Kano. That's a good development. And again, your governor, who had a feel of COVID-19, described it as a situation that will bring about that brought about excruciating experience, for him as a person. Therefore, it translates to the fact that he must have a very well-articulated program, towards this fight. But let us into those policies and programs put in place to fight COVID-19 in Kaduna State.
Thank you for the question. In Kaduna State, when we first got the news that there was an infection in Nigeria on the 27th of February, we immediately instituted an emergency operations committee, which started working on the 28th of February. What we did there was to assemble a multidisciplinary and multi-expert panel according to the guidelines of NCDC. And we developed a plan, incident plan, and started to implement it, which meant we were trying to get ready in case we picked up any cases. Our first case, the index case, as you mentioned, was the governor, and he was diagnosed on the 28th of March. So we had like a whole month to really get our plan in place and start our readiness to treat patients with COVID-19. Since then, as of yesterday, we have 215 cases. And like you mentioned, the spike in cases came when we diagnosed about 67 Almajiri that had been repatriated from Kano State. I'm happy to say that all 67 have been successfully treated and discharged. We have had 6 deaths to date. Most of these cases were in advanced age, also with comorbidities. A couple had diabetes, some had chronic illnesses. So what we have tried to do is to model the guidance from NCDC, the lessons learned from other places. We have 3 isolation centers. 1 isolation center is coming up in the next week in the southern part of the state, even though we have not picked up any cases from there. We have established 2 testing centers, and what we've tried to do now is to narrow down the number of wards where we've had cases coming out from. There are about 30 of those, and we're doing expanded testing within those communities. What is interesting is that lately all the cases, about 90% of the cases, have been contacts of the previous cases that we had. So we're expanding the testing in those communities, and we're building up also to look at silent wards, or LGAs as you may call them. We have an extensive border with about 7 states. And so we have to make sure that those silent wards or LGAs really don't have infections circulating. So this is some of the plans that we have.
Dr. Amina Balone, still tell us something in terms of the challenges that you face, particularly with trying to enforce the restriction on interstate movement. We know that Kaduna has been at the forefront of locking down and seeking to restrain unnecessary movements. But how well have you succeeded in this? Are people still streaming across your boundaries and therefore increasing the population of those who have been infected?
This has been quite a challenge. As you know, the President has ordered that there should be no interstate travel. But this is still going on. What we have tried to do was to limit entry points. We have about 24 legal entry points between the states, but we've restricted those to about 5, So if you have to come into Kaduna, we look at people should come in through those 5. And on those 5, we have manned it with health personnel, very senior government officials, security personnel, some community members. We also have a network of community members that are looking out for illegal routes. What we found was that when the main entry points were effectively policed, people created illegal routes and started traveling through them. So the communities themselves have been sensitized to let the authorities know that this is happening. We have brought the numbers of people coming in, except essential services. But it's still something that we're grappling with and trying to work out how best to make this effective.
All right, let's go over to Port Harcourt, where we have Dr. Tokbe Olamuyiwa, consultant family physician and health expert. Now, Rivers State, we just heard that the governor of Rivers State has cancelled the lockdown in Port Harcourt and Obuabo till further notice. I would like to know why that has become necessary at this point in time. And of course, we know that there were mystery deaths in Bonny Kingdom. We would also like to find out whether that is connected to coronavirus in any way. And some residents in Rivers State have been mandated to wear, in fact, all residents in Rivers State mandated to wear masks in public places, including rules, banks, shopping malls, hotels, markets, and in fact, any lawful social gathering. Give us more tips on the fight against coronavirus in Rivers State, taking into cognizance some of the issues that I raised a while ago.
Thank you very much. At the beginning of this pandemic, coronavirus pandemic, the Rivers State government made a proactive measure in stopping the interstate transfer of human beings. Then also, the Rivers State government made sure that the airports were shut down to reduce the flow of people into the states, and that has reduced the intake of the coronavirus into the states. And also, the relax of lockdown was mandated by the government because it's been noted about the spread of the virus was noted in certain areas which has been contained, where the team of the coronavirus team has gone through contact tracing to know who has been exposed to the virus. And containing this virus also in the states was also mandated by the state government, where we now have 2 testing centers and we have 3 isolation centers with 2 treatment centers, which also has contained the virus. Also, several numbers have been put into public domain for them to make calls to the state government or to the NCDC numbers for whoever has symptoms related to coronavirus, which has also helped in state government in containing this spread of infection. And also, the state government also still shut down the large gatherings in the states, marketplaces, malls, and also the worship centers, which has the prone of spreading this infection in the states. So for now, also the schools also are still shut down. That has also contained the spread of the virus. And with the sudden deaths in Bonny Island, the state government has mandated a medical team to go to the island to make inquiries of the cause of the deaths, which they are still making analysis of the cause of the deaths, and we are expecting the results very soon.
Okay, Dr. Olamuyiwa, thank you very much. We'll pause you and then return to you in the course of the conversation. Let's go over to Dutse, that's the capital of Jigawa State, where we earlier introduced the State Commissioner for Health, Dr. Abba Zakari Umar. You can see him there on the right side of your screen. Honorable Commissioner of Health, welcome once again to Good Morning Nigeria. What is the situation with coronavirus in your state? You are next door to Kano, and as we saw in Kano with unexplained deaths, we also saw the same situation in Jigawa. What is happening now?
Very much. I would say the situation in Jigawa State is, I would describe it now as stable, because so many measures were taken to ensure that, we are top on the issues pertaining coronavirus epidemic in the state. Number one, we established a 280-bed isolation capacity in the state with an ICU, 4-bed ICU, with all the retinue of gadgets in the ICU. And then we are also now working to scale up the isolation capacity to about 450. And I hope that in the next 2 weeks that will be done. Aside that also, we have 241 confirmed cases. And out of these 241, 159 have recovered and they've been discharged, and we had 7 fatalities. And it will be also interesting to note that out of these 241 cases, over 51% are Almajiris that are repatriated from some states in the country. And going into the Almajiris, we have 1,345 Almajiris that were repatriated.
Shame. It looks like there's a freeze there on the Skype connection from Dutse. Dr. Umar, once the Skype clears up again, we'll return to you. Now, Dr. Tokwe Olamuyiwa was back on the screen a while ago from Port Harcourt. Dr. Tokwe Olamuyiwa, let's get to learn some more as to what, in your opinion, has been most effective in the containment strategy of the state. We know that there are all kinds of radical steps that have been taken. Persons who are not wearing face masks even when they are driving or in public places have either had their vehicles impounded or they themselves have been charged and then tried and fined. But what exactly has been most effective in the state?
In my opinion, in the state, what has been most effective was the proactive measure of the Rivers State government by shutting down the airports and the ban of interstate traveling, and also the lockdown of all gatherings, all big malls, markets, and the worship places, because these are areas where vulnerable people will spread the virus, and also the mandatory use of face mask in the state. Before you go into any public place, before you go into any office, you must have your face mask on, which has also helped in controlling this spread of this virus. And the use of alcohol-based hand sanitizer and also be advocated in the state, the use of water and soap to wash your hands, and also the spread of the virus has been contained by enforcing people to stay in a place, because virus doesn't move, it moves with human beings. So people have been asked or encouraged to stay in a particular place, not to spread the virus, has also helped to contain Rivers State spread of the virus.
All right, thank you. We're just learning that we are reconnected to Dr. Abba Zakari Umar, Commissioner for Health of Jigawa State. Well, if you can hear me clearly, you may have to continue from where you stopped before I add another question to you.
Thank you very much. I was talking about the Almajiris that were repatriated to Jigawa State, about 1,345. Out of which 122 were positive. And as at now, almost all of them have been taken back to their homes, and only about 28 are currently under quarantine awaiting their test. And what the governor did was to ensure that each one going home is given a welfare allowance of 10,000 naira and a sort of grace. And eventually also the state government is going to implement this the Sangaya stroke Almajiri system of education, integrating it into the mainstream system of education. Aside that, also one of the challenges we had was with testing. Initially, we were taking our samples to Abuja, but later on to Kano, but there were a lot of congestions around Kano. So the governor decided to establish, a molecular laboratory in the state. Currently, we've procured the equipment, the laboratory. They've been installed, and we are currently test running the lab. And the Federal Ministry of Health have been contacted to come and accredit this laboratory. But then also aside that, there were a lot of works that were done on palliatives. And one of the things that we did was initially to ensure that all the Sangaya schools, the Almajiri schools in the state are given enough food items and also money to ensure that, they feed the Almajiris without them going out to beg. And this will help in terms of ensuring that they don't move from place to place, probably taking the virus along with them and transmitting it to other places. And then we are about to start our phase 2 of the palliatives, which is looking at the destitutes. But even before then also, we have 308 political wards. Polling units. In each of these polling units, we've taken 10 bags of meth, which were distributed to the needy in those areas. One other thing also is the issue around the welfare of our health workers. We ensure that our health workers receive, we incentivize them, they receive, for instance, doctors that are at the front line, receive about 10,000 naira every day as an allowance, and then we graduated that to other members of the team, the nurses and the environmental health officers and so on and so forth that are supporting the team. Then aside that also, we've implemented several strategies. Our lockdown strategies is not, is quite focused and it's specific. For instance, if in a particular local government, if we have a case in that local government, we don't close the whole local government, but we focus on a particular area, the village that the virus is, and then we lock down the village and do our contact tracing, take samples, and then after the results are out, we lift the lockdown. So currently, we have 2 local governments that are under lockdown. Duse and another local government called Kaugama. But we've also lifted lockdown in 5 additional local governments just in the last few days. So other strategies that we also implemented was to ensure that our borders are manned very well with the security agents. We have about 22 borders between us and other states and regional republic. We ensure that these borders are manned very well, not only with security agents, but also with healthcare workers to ensure that if it becomes necessary for you to come into the state, you have to be, checked to ensure that you are not a potential carrier of the virus. And the other things are issues around wedding. In the state now, wedding is for only, the gathering, the maximum is only 7 people, 3 people from the bride, 3 from the bridegroom, and then the imam or the pastor. So these are some of the strategies we are implementing in the state, and like I said, they seem to be really working for us. The state is quite stable for now. We have about 75 active cases out of the 241 cases. 159 have recovered and been discharged. And hopefully also we've taken the samples of additional 50 patients, which we think have also recovered. And we've taken to the laboratory in Bayero University, Kano. So hopefully in the next few days also we'll have this result returning, and we may also discharge additional patients. So that's where we are currently.
All right, we'll still stay with you, Dr. Abba Zakari Umar. You talked about your borders being manned, but your state has been accused of being responsible for most cases of the virus in Kwara State and some other neighboring states. And again, we would like you to tell us about the verbal autopsy conducted on the deaths that were recorded at the initial stage of this pandemic in your state, where, of course, a number of people died mysteriously, according to some people. So, and we're also told that such victims were, had fever, diabetes, high blood pressure, and what have you. Please come in here again.
Thank you very much. The investigation was carried out in Hadejia. Hadejia is one of the local government areas in the state. And we sent a team of health experts, including a public health expert, and then also in that team also somebody from WHO and NCDC. So what they did was actually to look at the data, the mortality data in the state. They went to the hospital, they went to the graveyards, and they also interviewed several individuals who are related to those individuals. And they tried to triangulate this data. And eventually what they found out truly, as at that time, it wasn't the issue of coronavirus, but it was like some other diseases, like you've mentioned when you were asking me the question. And also to, sort of substantiate that in that particular local government, we only have for now 4 cases of COVID-19. And out of the 4 cases, 2 have already recovered, 2 are in isolation. And we've taken over 31 samples. 25 of them have come out, and 23 are already negative. So I think as at that time, it wasn't COVID-19 like people are saying.
Thank you very much, Dr. Abba Omar. We'll return to you later on in the course of the conversation. Let's come back to our Abuja studios, where Dr. Kao is still with us. He's the Acting Secretary of Health for the FCT. Dr. Kao, well, aside from case management relating to Kogi and other contiguous states, which you earlier spoke about, how is the Federal Capital Territory faring in terms of its response to COVID-19 as well as enforcing the stipulated protocols?
Yeah, thank you so much. I think we are doing very well because we have enough bed spaces for all the infected cases. As you know, we have up to 1,000 beds. Now, we realize one big challenge. As you continue to go into this pandemic management of cases, you start having some issues. And one of the most important issues we realize in FCT is how to manage a suspected case. If somebody is confirmed, it's easy. You take him or her to the treatment center. Now, if you are suspecting a case, you must manage the case before the result comes out. I know the results don't come out early. Sometimes it takes 3, 4, 5 days, depending on your luck. So it has been a big challenge. We had only 5-bedded, what we call holding area at National Hospital. With the cases that came from outside this country, they have been quarantined in FCT, in so many hotels. They have been huge challenge. They call me in the night that so person is having serious problems. And if you send an ordinary medical officer, he will tell you, he gets scared. So we have to get those of our teams that are trained, and they get kitted to go and check those guys. Some of them needed admission. So why will you keep them? So it became an issue. So what we did was to get approval from the FCT minister and convert our Karo treatment center to a holding bay. So we have a team of trained and kitted personnel there. We have 30 bedded there. So anybody that is suspected in FCT, we quickly get there, pick the person to Karo if he needs admission, then admit. While waiting for the results, we manage the patient there. So if the result comes out, if it turns out to be positive, we straight take the person to treatment center. And if it turns out to be negative, we now send you to our normal hospitals for management. So I think this is what some states should learn, because you are trying to prevent death from COVID-19. If you are not careful, we have so many other people dying from cases that are not COVID-19. And the other issue we took very, very seriously is the issue of protecting our healthcare workers. We had, in some states, some health workers ran away and left the health facilities because they are not protected. And they are right. If you are not protected, how can you protect another person? So FCT has invested heavily in buying PPEs. And we have distributed these PPEs to all the health facilities in FCT, at least for the public hospital. And the private were advised, the management of the private were advised to get for their staff. I've been going around all the hospitals for the past 2 days, ensuring that not only sending these things to the hospitals, but ensuring that these things are available for the frontline health workers to use. It's not an issue of that I have 2,000 PPEs in my Maitama, and you go to the casualty and you see a nurse not having. So I ensure that those things are in place and they are available for the health workers. If you are not careful, if you have one health worker infected, the rest will run away. And who is going to manage the patients? So these are the issues we are doing in FCT. And we think for you to succeed, you must look at all these things. Thank you.
All right. Let's return to Dr. Amina Mohammed Baloni, the Commissioner for Health, Kaduna State. Dr. Baloni, Kaduna was among the first states, to impose lockdown. That's very impressive as at that time, but that did not actually stop, the spread of virus in Kaduna State. And lately, your governor had been so busy on the road, monitoring the implementation of interstate travel. But tell us more about the effectiveness of this interstate travel ban in Kaduna, which of course is bordered by some other states in the north. Tell us more. I mean, has the policy, or rather policies, that you put in place been so effective? And if yes, why is it that the spread of the virus is a bit on the increase?
Thank you very much for that question. If you look at the states that are contiguous to Kaduna State and you do a cumulative total of the cases they have, it's over 1,000, almost getting to 2,000, 1,005 getting to 2,000. Kaduna has managed to keep its numbers low. Like I mentioned to you, we had about 12 cases. And then the spike came with the 67. Earlier, I mentioned that with the very effective contact tracing we were doing and testing of the contacts, we were finding that we were not having, about 10% were new cases. A lot of them had a history of travel, but the 90% are actually contacts, and a large proportion of them, more than 60%, are actually family members of the cases. And as you know, if you have a case in a particular vicinity, it's likely that other people will be infected. So what are we doing about that? Like mentioned in the FCT, we have a few holding areas. So if we have a suspected case and we go there to assess that case and take a sample, depending on the conditions the person is living in, we either allow them to be at home if self-isolation is possible, and if not, we pick up the suspected case and take him to a holding area, him or her to a holding area. Once the test results come out, if they're positive, we proceed on treatment. If they're negative, we allow them to go back. So these are some of the measures that we've taken. Like I mentioned, the drop in influx has been noticeable in the last 2 weeks when we have, like you mentioned yourself, the governor, the deputy governor, commissioners, very senior officials actually at the border What has been a challenge is that if you have lower level officials, people pull rank on the security agencies or the health workers there and say, oh, I am from, I have a pass from Abuja, I have a pass from Kano to pass through. But we have tried to effectively only allow people that are on essential movement, whether to do with health, essential workers, food, trucks and things like that, so that it's only the people that should be moving are actually moving. Another thing we've done is also to establish, if you insist you have to come into Kaduna, we quarantine you. We quarantine you for 2 weeks and watch you. We have just recently discharged people from the quarantine center. We picked up 3 cases in about 50 of them. But we watch them for 14 days. If they're symptomatic, we test them before. If not, at exit, which is after 14 days, we test. So it's a work in progress. What we've also tried to do is to continue with a campaign of awareness in the communities, and very often the communities themselves will call and say, oh, someone came in, slipped through, and came in from Kano, or he came from Abuja, or he came from Lagos, and we're concerned about him. Please send a team to assess him. And so it's something that is evolving, but it's very important, like my colleague said from Rivers, that it's not the virus that moves, it's people that move. And we have to be mindful that as people move, they will move with the virus, especially if they're coming from an infected area. What we're trying to do now is to launch a campaign called Forward, which will support the health measures. Frequently wash your hands, observe physical distancing, avoid crowds, eat good food, boost your immunity, do some exercise, and with that we're trying to get the citizens behind the fight against COVID. Everyone matters. And it's very important that we take personal responsibility and help the health personnel to combat this disease.
Thank you very much, Commissioner for Health in Kaduna State. Let's return to Port Harcourt. Dr. Tokpe Olamuyiwa, earlier you ticked off some of the critical success factors in the Rivers narrative with regard to containment of COVID-19. But Rivers still has about 170 persons who have been infected. Some of them, of course, have been treated and discharged, and unfortunately, some fatalities. Do we have a sense of, for instance, what the distribution is by way of infection between upland and the riverine areas? Do the riverine areas appear to be insulated from the infection? And allied to that, what are the challenges that you see with the measures that the government has tried to introduce and enforce?
Okay, thank you very much for the question. And so far, the government has tried in several ways to contain this coronavirus. And so many sensitization has been put up in different ethnic languages in Rivers State, which has also helped to curtail the virus. The recent increase in number of coronavirus cases in Rivers State could be due to the fact that we now have testing centers in the state that's testing new cases, and also the borders has been closed down for people entering the state. We still have few cases of people trooping into the state, and they could be the reason for the increase in number of coronavirus cases. And majority of these cases are seen within the main town of Rivers State, which is Port Harcourt local government and Obiakwa local government. That was why the government shut down the 2 local governments for lockdown for those periods of time, which are also helping curtailing the virus spread and contact tracing of individuals that were exposed to the virus in the states. And several measures has also been put in place to help in containing this virus. Different organization, non-governmental organization, and distributed sanitizers, hand glove, face mask, other measures for health workers to use to care for these patients, and also for the residents of Rivers State to make use of. So far, the virus has so far been contained in Rivers State, and because it was basically within the Port Harcourt local government and Obiakwa local government, and for now, we are comfortable with what is happening around now and with the testing system also.
Okay.
Akira, there's the other leg she left out. Dr. Tokma, I asked, where you've indicated what the government has been doing and the fact that you are comfortable with the measures. So you have no challenges, or there are no challenges in Rivers?
Okay, the likely challenges we could have is the people that are tripping in through the border in the midst of bringing in foodstuffs to the states. Some other persons come along with these food materials to the states, which are the major challenges the Rivers State government is having. Even though the government decided to make a coronavirus committee to look to the borders of the states to ensure that other people don't come along with the food materials that are bringing into the states. And also, the challenge of to seek for medical help. A lot of people by themselves decide to stay at home. But now we have emergency numbers that we put into the public domain for people to make calls when they have any concern about their health, so they won't self-medicate. So the emergency response can come over to their places and pick them up for response.
Okay, it is more interesting now that you have admitted there are challenges, because the question Kingsley posed was actually trying to find out what is happening in the riverine areas, or are they insulated, from this? Because of course, the terrain is rough and tough, and considering the ubiquitous characteristics of this virus, it would be difficult, to conclude that some council areas do not have cases. Anyway, when we come back to you in the course of the program, you may tell us more about what's happening at the riverine areas, like Bonny areas and what have you. You are watching Good Morning Nigeria on the network service of NTA. We are taking a short break now. We'll be back in a moment.
Nigerians, coronavirus is dangerous. It can kill. When you see this sign, high fever, cough, shortness of breath, drowsiness, pneumonia, don't panic, don't hide, don't embark in self-medication. Promptly visit the nearest medical facility. Report all cases to the nearest hospital. Prevention is key. Avoid contact with infected persons. Avoid crowded areas as much as possible. Wash your hands regularly. Use hand sanitizers. Your life is precious. Stay alive. Live long, live right. This message is sponsored by the Federal Ministry of Information and Culture and the Nigerian Film Corporation. Nigerian Film Corporation, powering possibility.
As a strong immune system increases the chances of victims surviving COVID-19, a corruption-free society creates opportunities for citizens to thrive and prosper. Build your immunity. Stop corruption now. Report all acts of corruption to ICPC on this toll-free number 0800 2255 4272. This message is brought to you by ICPC and NTA.
Nigerians, let us take responsibility. Stay healthy, stay safe, and curb the spread of the virus. Take responsibility. The coronavirus spreads from one person to another. Let us avoid crowd gathering of any kind for any reason. Take responsibility. Avoid traveling from one state to another during these lockdown restrictions. Obey all the rules that are put in place. Take responsibility. Stop spreading fake news and unverified reports about the coronavirus. There is no known cure for COVID-19. Take responsibility. Observe all the measures that can help stop the spread of the virus. Together, we can do this, but only if we take responsibility. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
You're watching Good Morning Nigeria, reaching you on the network service of the Nigerian Television Authority. Now, let's read out what some of our viewers have sent in by way of tweets. Law Alpha C. The incidence of COVID-19 has substantially dropped in the FCT thanks to stringent measures put in place by the authorities, which residents are complying with. So other states, including Jigawa, should follow suit.
All right, Mike Anyako, as we are easing the lockdown in the entire country, we must all act as if we have COVID-19. This is a deliberate precautionary measure against the pandemic that is being proactive. Well, be it as it may, the news from states like Kaduna, Rivers, etc. are not palatable, with obvious indecisions on the part of the government would stopgap approach to issues.
Well, I hope Mike Anyako has been listening to the two guests we have this morning, speaking from Port Harcourt and Kaduna, and indicating the measures they have taken, as well as other ramp-up ideas that they have in place.
So I don't know where the stop-gap approach is
coming from. So that's would appear to be incorrect. Now, Innocent Yawa James, that's the next tweet we are taking. He says, no doubt about it, the level of seriousness isn't as before. Everyone seems to be tired of the virus, as it were. The economy can't grow if the states are still on lockdown, and sincerity should be seen by Nigerians in the fight. Federal government is doing its best in terms of sensitization.
Chris Simeon, there is no confirmed case in Sokoto for some days now. Meanwhile, everyone seems to be tired of COVID-19 due to rising number of cases. Minister of Health and the NCDC may be overwhelmed.
Onyebuchi Ezenwa, many Nigerians are not adapting to the safety measures like the use of face masks in public places. I think Nigerian governors should step up their efforts through the security agencies.
Festus Akimboewa, no state in Nigeria has zero risk for COVID-19. Actions and behaviors matter if we are to defeat the deadly virus. Sadly, testing, tracing, social distancing, hygiene and isolation are still lacking in many states. The slow and bungled response from many of our governors must stop.
Francis Obi, there are stories making the rounds that in government hospitals, any case of cold, cough, or headache leads to the quarantine of patients for COVID-19. The rate at which cases are increasing is alarming and would tend to suggest that the stories making the rounds are true.
Delajak Solomon, continuous rise in the number of confirmed cases in recent days is a worrying sign that the authorities must prepare to respond to the worst of the crisis. Even states like Kogi that had none have recorded its first two cases.
Amogbala Humbabs, now how each state responds in terms of advocacy and treatment of victims is a reflection of leadership. Nigeria will be better for it if states provide adequate leadership.
Ibrahim Abdusalam Bello, as the community transmission of the virus goes exponential, the level of consciousness in most states is really decreasing by the day. This is glaring from what we see on the streets. As the government eases the lockdown in some states, people are gradually returning to business as usual.
Well, and Eno Ayuk also writes in the same vein of graduality. He says we are gradually having a slow but steady rise of COVID-19 in Nigeria. However, some states are lacking in the area of testing, contact tracing, and even standard isolation centers. States that claim that there were no cases did so for political reasons. How do you know?
That's the point. That's the point. Alhaji Musa Mohammed Hadejia, the plan to avert the pandemic of COVID-19 in Jigawa needs honest and sincere task force committee at local levels because there is communication gaps between the government officials and traditional rulers.
Aminu Halero, COVID-19 situation in Nigeria is tolerable. Now, most especially the Federal Ministry of Health, NCDC, and various state governments have been doing well in their respective capacities, but unfortunately, the majority of the people are still not complying with protocols.
Ruben Naberi, poverty is a disease. Some people keep criticizing state governments for staging COVID-19 in their states to grab huge sums from the federal government. The streets of Port Harcourt and River State are back to normal following the cancellation of lockdown, but adequate measures are lacking as buses and other major places remain crowded.
Now, this is from Ibrahim Abdul Salam Bello. The proactive measures against the pandemic are often displayed on the electronic and print media, but they are less practical in remote areas, as government can't distribute the sanitizer, face masks, and even enforce social distancing in some congested locations.
Aminu Haliru, I think adequate sensitization, consensus, dialogue, and social mobilization need to be done in order to carry everyone along in the fight against the deadly virus, because majority of the masses don't believe that the virus even exists.
Now, Ibiatan SM, that's the Twitter handle. There has to be a balance between staying at home to prevent COVID-19 and starving at home. These are two ways of saying the same thing, health of the people. And that's why Maslow, I think you referred to Abraham Maslow, made safety the second stage of needs in his hierarchy.
Yeah,
okay,
that balancing is a delicate balance. What he's trying to say. Balancing between using the lockdown, of course, going back to normal.
That's right. That's right. Let's bring in again Dr. Kau. Dr. Kau, one of the issues that we've had to deal with on Good Morning Nigeria has to do with other than COVID-19. There are still other health challenges. We've had a situation in some other locations where medical personnel reject persons who present with other conditions because of the assumption now, which is precautionary, that any person that comes is suspected of having COVID-19 in the first instance. And where they don't have PPEs, that becomes a challenge. How well is the FCT dealing with persons who have other health challenges other than COVID-19, or indeed, for that matter, persons who have the so-called comorbidities?
Yeah, thank you. I just said it the last time I spoke here, that it has been a challenge, and it's a big challenge. There's apprehension amongst everybody, including the health workers. But the most important thing is to ensure that the health workers are protected, and that for every state to succeed in this case, you must protect your health workers properly. And don't forget, these PPEs are very, very costly, extremely costly, and they are disposable. So they are not.
What is the average cost of one, by the way? Sorry to interject.
Yeah.
You have an idea?
I always refer to Lagos Commissioner for Health. He said, when you kit a health worker to enter and treat a COVID-19 patient, you have 70,000 naira cost of kitting a health worker to enter and treat a patient. And that is definitely moderate. And that is Lagos, because things are obviously cheaper in Lagos. So you come to FCT, probably is getting to 100,000. The N95 face masks, when we started the issue, it was 2,500, 3,000. Now, 7,000 people are not supplying one N95 face mask, which is a must. The PPE gown is getting to 20, 30,000. So by the time you get all the things, the face shield, the goggles, the gown, the shoe, the glove, and all other things, it's huge. But you don't have to wear all this to see a patient coming. So what is important is to maintain the well-known infection prevention and control measures that are known to all health workers. So we have to continue to train them. Now we have a triage in our hospitals. We have a staff at a specific place. Anybody coming follows that. Take your temperature, look at you. If you are a suspected case, there's a team that is already kitted somewhere. They now see you. So that will help build confidence in the other staff. They know anybody coming is less likely to be infected. So The second most important, I said from Kaduna, that you have to have a holding bay. The highly suspected case, you can't take that person to the normal ward. So you must have a place where you keep the person. While you take a test, you continue to manage the person and wait for the result. If the result comes out is positive, you know where to take the person. Of course, the treatment centers. If it's negative, you take the person to a normal hospital and everybody is comfortable. So if you don't put these things in place, you are likely going to have health workers that are apprehensive, that of course, if I don't have enough protection and the suspected cases, I'm not likely going to jump onto that patient. And a lot of people have been infected through that. We have one of our colleagues who works with us in FCT, who is a very senior doctor that is specializing in ONG. She got infected in managing her brother-in-law. She is presently in our treatment center. Thank God she didn't get in our hospital. But it's because she did not take precaution. Maybe she didn't know the brother-in-law had COVID-19. So it's a big challenge. And I think most of the states should learn from what is happening to other states. And as the numbers continue to increase, you have these challenges. So in addition to getting isolation and treatment center, you must have a holding bay where you keep suspected cases. And you must invest in PPEs. And you must remunerate the health workers adequately.
Yes, and PPE is not just a challenge to Nigeria, it's a challenge global, it's a global challenge. And most countries have started looking inward to see how they can on their own begin to produce some of the PPEs in question. Because, yes, the ones we're talking about, because of the nature of technology that produce them, they're disposable, right? You don't have to reuse them, after the first instance. So that is understandable. But what the task force did say about a week ago with respect to the issue of looking inward is very, very apt. And the more we do that, the better, because of course this thing is still on the ascendancy, and nobody knows when flattening will begin. Now, let's return to Jigawa. We have Dr. Abba Zakari Umar. When we were going through the tweets from some Nigerians, one particular one pointed the fact that in Jigawa State, there is a communication gap between government officials and the traditional rulers. If that is true, why should that be? Or if it's untrue, then let us know the kind of synergy that exists between government officials and the traditional authority, who are also key, in terms of spreading the news of coronavirus and convincing people on the existence of the virus.
Thank you very much, and I'm really surprised that somebody is saying that there is a disconnect between the on one side the government and the traditional and religious institution, because number one, in the COVID-19 task force in Jigawa State, we have a representative of the traditional leaders, representative of the MS. We also have a representative of the Council of Ulamas in the state, as well as the special advisor on religious duties. That is number one. Number two, also ab initio, when we're engaging with the opinion leaders, we had meeting with the governor, with all the mayors of the state. We also had another meeting with all the religious leaders of the state. And everything that we do actually in consultation with the religious and traditional leaders. For instance, if we're looking down a town, those in government sit down with the traditional leaders, for instance, either the district head or the emir, to agree in terms of the modalities on how that is going to be done. And then even in terms of opening places, for prayers, we consult with the religious leader. Of recent, the Eid al-Fitr. We discussed the modalities on how this will be done, and then we agreed on how we can move forward. So I'm really surprising that somebody is saying that there is disconnects between the government response and the religious institution. I'm sure the religious leaders will not, the traditional leaders will not agree with what you've said, because another thing is, at the beginning, all the emirs, made some comments which were recorded on the radio, and they were aired in the radios in Jigawa State, all the 5 emirs in the state. So, they are into this. We are working with them together, and I think we are making progress together. Thank you.
All right. Thank you very much, Dr. Abba Umar, via Skype. Now, let's return to Kaduna, where the Kaduna State Commissioner for Health is still with us. Dr. Baloni, well, Kaduna was one of the earliest to impose a lockdown, and we're talking now of over a 2-month period, as it were, and gradually, even the Federal Presidential Task Force on COVID-19 is talking about the relaxation of the lockdown and reopening the economy. But from the health perspective, that's to say the numbers you are looking at and what the projections are, is Kaduna ready to reopen for business? And if so, fully or partially?
Thank you very much. Yesterday there was an announcement and an extension of the quarantine order for 2 more weeks with some easing of restrictions. There was also a document released of the roadmap to how the gradual and phased lockdown would be done. But of course you have to follow the science. If you look at the science, it says if you have cases increasing, you should be cautious in opening up. But then, like someone said, there has to be a balance. We recognize the limitations of the society we live in. We recognize that there are many people that need to go out and fend for a living daily in most cases. So this has to be taken into consideration. What we are doing in the next 2 weeks as we gradually phase in the reduction in restrictions is to increase our testing. And like I said, we've mapped out all the communities and wards where we have cases. We're increasing testing there around the community in aggressive contact tracing. And then also to look at the other LGAs and the wards that are silent, to also do some sampling there so that we have an idea if we have virus circulating in a particular area, and that helps us to better target our response. So far we've done 2 or 3 communities. We've had cases. We've picked up 1 or 2 cases apart from the contacts, but these are usually in the close vicinity of the either the contacts or the cases. And as you increase testing, you will pick up cases, so there will be a rise in numbers. And don't forget, the measures that are placed to tackle this epidemic is so that you slow the rate of infection. You prevent an explosion of cases at any one time, which will have the effect of overwhelming the health system if you don't do that. So in terms of that, we're doing well, we're coping well. We haven't exceeded our capacity to increase. And also to mention that we're cascading all the protocols on how you identify cases at community level, at the PHC level. We've done a lot of training across the state in health workers, including private practitioners, so that people have a high index of suspicion. People know what to do when they are confronted with a suspected case. And there's a network to make sure that we're not missing these cases, because the more you leave them in the community and you don't treat them or isolate them, the more likely.
All right, Dr. Amina Mohammed Baloni, we will have to cut it short there to enable us to bring in Tope Olamuyiwa to have her final thoughts on this matter. Dr. Olamuyiwa, we heard from some persons who actually tweeted to us that since the cancellation of lockdown in Port Harcourt and, of course, Obuabo area, that it does seem as if life has returned to normal, as nobody is paying attention to the protocol required for them to engage in activities. Briefly, please.
Okay, thank you very much. As we know, for this COVID-19 pandemic, to curtail it, we need to take it into our hands. We need to be responsible for what we do. People have to be able to make conscious effort to obey government instruction. The lockdown was relaxed with instructions from the government for people to comply with. For now, public places are still under lockdown. Then just few places are relaxed, and people are supposed to go out wearing their face masks and with their sanitizers, and also to reduce large gatherings. So we are supposed to take this into our hands and be responsible for our actions. Thank you.
All right. We'd like to appreciate Dr. Tokbe Olamuyiwa. She's a consultant family physician. She joined us from our Port Harcourt Network Center. Thank you very much, Dr. Olamuyiwa. From Dutse, that's the capital of Jigawa State, we're also joined by the Jigawa State Commissioner for Health, Dr. Abba Zakari Omar. Dr. Omar, thanks a lot for your contribution to our discussion this morning. Our another network center, the Kaduna State Commissioner for Health, Dr. Amina Mohammed Baloni, was with us. Dr. Baloni, thanks a lot for your contribution to our program this morning. And then right here in the Abuja studios, we had Dr. Mohammed Kawu, one of our most regular guests on our conversations on COVID-19. Dr. Mohammed Kawu is the Acting Secretary of FCT Health and Humanitarian Services in Abuja. Thank you very much, Dr. Kawu.
Thank you so much.
All right, so that's it for us today on Good Morning Nigeria. As always, we appreciate your tuning in. We are back tomorrow for the last edition for the week. Until then, take care of yourself by staying safe so that you'll be well. I'm Kingsley Osadolo.
And I'm Kirian Umaya. Thank you for watching. Be back again with us tomorrow.
The following guidelines for eased lockdown, as announced by the Presidential Task Force on COVID-19, are effective from 4th May 2020 in Abuja, Lagos, and Ogun states. For public spaces, the following are mandatory: improvised face masks, temperature checks, hand washing facilities and hand sanitizers, physical distance of at least 2 meters, no sporting activities and mass gathering. On travel, these are prohibited: passenger flights, interstate travel except essential services, movement of agro products and petroleum products. Note, there will be mandatory supervised isolation of returnees for at least 14 days. For markets and offices, neighborhood markets are to open 3 times a week from the hours of 8 a.m. to 3 p.m. Banks and financial services are to open from 8 a.m. to 2 p.m. Government offices are open only to staff from grade level 14 to 17 between the hours of 8 a.m. and 2 p.m. on Mondays, Wednesdays, and Fridays. Corporate offices and private sector are open to business from 8 a.m. to 2 p.m. Schools, churches, mosques, clubs, bars and gardens remain closed till further notice. COVID-19 is real. Take responsibility and stay safe.
I wish to once again commend the